Speaking of catastrophe, I'm here to talk about reproductive health in the time of Trump. And when Leanne actually asked me to address this, I said, it doesn't take 10 minutes to say we're fucked. So that's it. That's the end of my speech. No. For those who didn't feel the need to get a drink on the last break, you'll definitely be wanting a drink after this. But on a serious note, I'm really excited to be here talking to you all. This is actually my first Lesbians Who Tech, and I admire of you all in the community, and I hope that I don't have a permanent reputation for being a Debbie Downer after this. But I feel like it's really important time for the tech community to be engaged with these issues because tech is already a vital part of how and why people access reproductive health care. Of the 2 trillion Google searches that happen annually, 1 out of 20 of those are related in some way to health. And so I think that's a really interesting way to set the tone for the adventure we're going to go on for the next 10 minutes. And hopefully I won't bring you to too much of a dark place or a grim place. Maybe Kieran can help get you out of that for the next session. So let's start on a high note. The Women's March. Yes, who was there? Who turned out? This was the largest political demonstration in US history. 1 out of 100 Americans attended the Women's March, and here in California, 1 out of 45 people were there. Yeah. It was amazing, and we know that this incredible turnout was obviously motivated as resistance to an incoming administration, but we know that in part it was also a way to answer to a lot of racism, xenophobia, and attacks on reproductive health and bodily autonomy that had been building for a long time. Since 2011 through July 2016, 330 separate individual attacks have been leveled at the state level on reproductive health care. That's a lot of creativity. How do you attack something 330 different ways over a 5-year period? Well, we're finding out. And so the Women's March was a way to come out and say, you know what? We are sick of it. We're going to resist this. We're not going to stand back and do nothing. And when it comes to that, I think that it's important to start there because resistance is going to be a theme that we're going to have to return to. Unfortunately, this didn't stop Donald Trump from issuing a number of harmful bills and measures in his first days in office. So now on top of the state level fights and the Planned Parenthood defund effort, which I'm going to get to a little bit later in this talk, we now have a lovely thing called the global gag rule back on the books. So many of you might be familiar with this already. It's actually an archaic policy, also known as the Mexico City policy. And I think it's interesting that Donald Trump chose 2 days after the Women's March to make one of his first executive actions at all, period, let alone on reproductive health. And he focused on the most vulnerable women in communities in the entire world. That was what he decided to do, is restrict access to care for those people. And what we saw in the global health community is that this was an unprecedented executive order. In the past, the global gag rule has applied to international family planning funding. And what it does is it says, if you're a group outside of the US who's working on international family planning, as a criteria for being eligible for US funding, you need to renounce abortion. You need to renounce it not only by agreeing not to provide it in your health centers, but you also aren't even allowed to have a pamphlet in your waiting room that says what an abortion is. You're not allowed to counsel a woman who comes into your office asking for what her options are when it comes to pregnancy. You're not allowed to advocate for abortion on your own time, with your own dime, when abortion is legal maybe in your own country, if you want to receive $1 of US funding. And what Donald Trump did is he expanded that in a way where we've never actually seen this before. People in the global health community are still rushing to figure out what this will actually look like. But what we do know that by moving this policy from just family planning funding to all global health funding, we are talking about approximately a 15-time expansion of what this could mean. The scope is 15 times as large as it's been in the past. And so now, instead of just applying to family planning programs, which was already harmful and dangerous and kills women, it also applies to charities who are working to prevent HIV/AIDS in their communities. It applies to charities who are working to reduce maternal mortality in their communities. And it applies to folks who are working to prevent Zika in their communities. So up to $9 billion of funding potentially at risk because of this policy. Let's take a look at what our response to that is going to be. You think we're going to take this lying down? It's not going to happen. So if we have anything to say about it, this is what our response is going to be. There are a lot of people, I think it's safe to say a lot of them are in this room, that are determined to stand up and fight back to these kinds of policy changes. We're not going to let women down, we're not going to let LGBTQ people down, and we're not going to let our communities down. We won't give in to the threats and to the intimidation. Yes, yes. We got to get riled up, and we have to mobilize our millions of supporters nationwide to say, especially here in California, where actually you're living proof of what's possible in my mind, to say, here's what the facts are about reproductive health care, here's the face of reproductive health care in this country and around the world. So let's get into some non-alternative facts. Polling shows that not only are reproductive rights attacks dangerous, they're unpopular. The country is with us when it comes to reproductive health. 70% of people oppose defunding Planned Parenthood. That's brand new polling that's just come out. And we also know that support for Roe is at an all-time high. 70% of people oppose overturning Roe v. Wade. By the way, nearly half of Donald Trump voters also oppose defunding Planned Parenthood, so this isn't something that he has a mandate to do at all. So I say this because while people are rightfully scared about what a Donald Trump presidency could mean for their health and their lives, I think it's also important for us to push back and say, you know what? This is very popular. We're not going anywhere. We're not going to take this lying down, and we will continue to be here. That's important politically, and it's also important for the patients who depend on Planned Parenthood for access to care. Here are the real facts about Planned Parenthood. 1 in 5 women will be a Planned Parenthood patient in her lifetime. Of the 2.5 million patients who come to us annually, and this is important for later, up to half of them come to us through Medicaid or another public program. So we also happen to work globally, supporting access to care in over 12 focus countries across Africa and Latin America. And when we say that our motto is care no matter what, that really means that we care no matter who or what you need, and we're proud to offer a full range of reproductive health care, including birth control, breast exams, cancer screenings, HIV testing and treatment, and yes, safe and legal abortion. We're proud to serve people regardless of income, geography, sexual orientation, gender identity, and yes, immigration or refugee status. So this is the real face of defunding Planned Parenthood. Here's who politicians are really defunding. When politicians say they want to defund us, what does that really mean? We know that no federal funding for abortion can actually be provided unless it's in the rare cases of rape, incest, or to save the life of a woman. So there's no budget line in the federal budget for Planned Parenthood. When we're talking about defunding, being reimbursed for specific preventative service, just like hospitals and other organizations that provide care. What defunding actually means is preventing our patients who are on Medicaid from coming to us for preventative care when we know that that's actually the best way to reduce unintended pregnancy, to catch cancer early, to achieve all of the goals that people on the far right say that they share with us. But actually pass policies that prevent us from achieving that. And we know that defunding has a disproportionate impact on people who look like me, women of color, people who are low income, and people who are living in rural parts of this country. By the way, this happens all the time. I go into a room, I tell a person where I work, and they say, you know what, you guys are always in the news, you're always under attack. Why do you persist? Why don't you just let them defund you and just let another group or another health center pick up the slack? You know, give it up. It's been a wild ride. And I say that's not actually how healthcare works in this country. You can't actually say, oh, just absorb those patients in other places. And actually, this idea has been resoundingly dismissed by experts. So we see people saying, okay, you could just pick up the slack from somewhere else. And in 20% of counties with a Planned Parenthood health center, Planned Parenthood is the only safety net family provider in that area. So what does this all mean for you? We know that tech is vital. We know that Planned Parenthood is here to stay, but we're also constantly under attack. And I don't know if folks have seen the news, but just today there was a draft bill that was leaked to the media showing what we have in store for us. It's a defund bill, and that will probably come down in the next few weeks. So this is real and this is happening, so I don't want to downplay the extent of the attack and why we really need everyone in this room to get engaged and stand with us right now. Even in a tough political climate, this is first and foremost, tech presents enormous opportunities to deliver care in a lot of new ways. So I don't want us to lose that drive for innovation and that drive to really bring care to more people, even though the times are tough. That being said, we still need individual action. We need everybody here to stand with us, share your stories, share your love for Planned Parenthood, get out on social media. Of course, those donations help as well. But I also think that we know from personal experience, the best way for corporations to get involved in what can sometimes be a stigmatized issue is to hear from their employees who are getting vocal and getting engaged. So we also need you as founders, as entrepreneurs, as employees at tech companies to push from the inside for tech to come out and support us at the company and organizational level. That'll still be really important in the days and weeks to come. Of course, we know when reproductive health care is available, that's always good for employees and it's good for business. So it's a win-win for all. You don't have to worry about that. And I also want to share with you that we're gearing up to be able to partner better with tech. My colleague from Planned Parenthood who runs digital advocacy, Heather Holdridge, is here, and she has, I'm sorry to put you on blast here, but a lot of Planned Parenthood swag on her, talking about tech loves Planned Parenthood, so I would go find her and pick up some of that. And more importantly, we're going to be at South by Southwest in a few weeks, launching different ways for tech to get engaged. So actually right now, there is something you can do, which is join our Defenders program. And I'm going to tell you to text a number which is 22422. Text FIGHT to 22422 if you want to get engaged with our Defenders program. Defenders, yes. Okay, text Defenders to 22422. Either one will work. And we also want you to just keep in touch with us on social media and especially speak up. Share your voices in those times when you're not sure, because keep in mind the real folks who are at stake when it comes to reproductive health care. So I really appreciate your time. Thank you for standing with us.